Well, Dr Angelique Coetzee, the chairperson of the South African Medical Association, gives us her take on the acting minister's media briefing. Angelique, your gut reaction to the acting tourism minister's address to the nation. What points did she hit? What points did she miss?
Well, at least there was communication to the public and to us all out there, which is very, very needed. So, I'm happy to hear that the military will assist, but you have to understand, before they can assist, they also need to be vaccinated, because you can't send people out who's not been vaccinated to go and do track and tracing and to help. So hopefully they will first be vaccinated with these vaccines coming in. We heard that they are planning to do the workplace vaccines and vaccinations. Phase 2A, we heard that above the age of 60 years, 400,000 people are earmarked. And then in Phase B, about 40-year age groups, they will also 4.8 million. We also heard that the security cluster, the police service, as well as the military services will be earmarked to be vaccinated. Unfortunately, the military is very slow. We had a lot of complaints from our doctors working in the military regarding vaccines rollout to the military. So yes, this is very nice. I really, really hope that these people are being vaccinated before they do their work. We also heard that there would be 145 private sites for the different sectors being rolled out in the private sector. So let's hope that will help a bit. But we can have all of this, and if we don't do the work, on paper everything looks nice and be great on paper. It comes in the once if you start to implement. So implementation is normally the problem.
Absolutely.
In our country.
Dr. Coetzee, the acting minister, was quite direct about how dire the situation in Gauteng could get.
No, not could get. It's already there. So in Gauteng, it is a huge problem. Currently, again, we have said this now the last week regarding private, especially in the private sector, to get beds, to get people admitted. And I can promise you, if it's like that in the private sector, it can't be different in the public sector, because the public sector services more people than the private sector. So what we think is going to happen is that they are missing the colds and flus, think it's cold and flu, not cold and flu, COVID-19. Those people 2 weeks from now on that's been missed will spread the virus to the elderly population. And it is going to give us huge increases in admission rates in the public sector. I heard that they also wait to see whether they need to start with field hospitals. The problem is you can have as much field hospitals as you want. If you do not have doctors and nurses manning those field hospitals, especially with the ones that needs oxygen, high flow nasal oxygen, it's not going to add any value.
Dr. Coetzee, do you think Gauteng schools should be closed, considering 70% of cases are there?
Well, Gauteng schools should definitely be closed. There should be a call for everyone that can work from home for the next 3 weeks to work from home, not to get into public transport. And if you have to, we have said, don't speak in while you're sitting there, because it's droplet spreading. And if your mask is not properly fitting, then you will spread it in the close encounters of the public transport. We have also asking that please, no more than 10 people anywhere. Doesn't matter whether it's a church, wherever. Please don't go there. And we need to be careful with the opening of of the allowance, or that your hospitality sector can sell alcohol over the weekends. We don't want people in places where they come together. We want people drinking at home and not in public sector.
All right, that's Dr. Angelique Coetzee from the South African Medical Association. And just to give you, to back up what she's saying, an SMS came through to me earlier from a doctor in Johannesburg. It's doing the rounds, a well-known doctor. And this is what she says. For the last 2 weeks, it's been increasingly difficult to find a hospital bed, both private or public, in Gauteng. Ambulances wait with sick patients in parking lots to try and get them in. People are struggling to breathe. For the first time, we are battling to get oxygen to private sites. I have a small practice. A lot of my patients are on ivermectin and anticoagulants. Several of my patients have had the Pfizer vaccine. Some have had the Johnson & Johnson vaccine, but they're still getting pneumonia. And this is for this week, for the first time, it's been a struggle to find enough oxygen for patients needing it at home. There are waiting lists for major oxygen suppliers. So not to play down at all what the minister is saying, she is right. The situation, especially in Gauteng, is dire.